The biodynamics of osteopathy in the cranial field, this is a term coined by a DO who was noticing that there was some drift in osteopathy away from these really important, deep, profound principles and a drift towards some of this more reactionary medicine that's much more common outside of osteopathy. And so he wanted to hit the refresh on those principles. So he developed a way of teaching people and a way of conceptualizing that I have just found so incredibly beneficial. There are 10 phases in learning it. I've just done 3 phases so far, but it just matches up with all my experience, and it takes away some of the stress that's associated with treating other ways. So none of these are my own realizations. I'm standing on the shoulders of giants, really. And the body addressing these problems, well, it's the one accomplishing the release as well. I'm following its ease and I'm listening for its neutral. I've already talked about direct and indirect, but even within direct, there are different tissues that can be targeted, so different techniques. Within indirect, there are different techniques that are described, but it's basically all the same thing, but just with a few little twists on it that are different. So indirect is basically take it where it wants to go. Direct is take it where it doesn't want to go. Within biodynamics of osteopathy in the cranial field, this is where we're taking it exactly where it wants to go. We're not exaggerating. Because you can go indirect and exaggerate to try to accentuate a release. But if you don't get the release, or if you're not sensitive with that exaggeration, the risk is you encourage the dysfunction. And that generally a good osteopath isn't going to do that. That's a fine technique. But this idea of taking it to its neutral so that flow returns, then letting the inherent forces do their work. In my experience in my career so far, this is how I've been able to go the deepest and get the best results with the least sort of stress or strain on myself. So I mentioned, what does a treatment look like? It starts with that listening, that feeling for flow, and that'll show you the absence of flow. So then once the absence of flow is clear, the thing to do is what you can do is go to that region, go to the border between flow and absence of flow, and then tune the structure to flow. It's kind of like tuning a radio till you hear the station clearly. It's finding that balance of tension where normal is reestablished, where the flow can now go through there. And that's where the body can let go of inappropriately held restrictions. Well, not necessarily inappropriate. Let me correct that. Where it can let go of trauma residue. Trauma residue is just an expression of health. The residue is from what the body did to give its best chance at surviving the trauma with the least injury possible. So one of the things we do is we tense up so that the spinal cord doesn't whip really, really majorly and then cause cord damage. And we tense up to try to protect the organs. If the abdominal musculature tenses, well, then it's going to be harder for some sort of blunt trauma to, say, bruise an organ or cause internal bleeding. So that it makes sense, and that the body does that. And so it's actually a manifestation of health. These things that after the injury cause problems, they're just sort of frozen health. Like ice is frozen water, and they want to return to fluidity. So when we tune the balance of tension, they can become fluid again. And generally the position is, like I described with the hit to the head in the earlier part of this series, to achieve release, we generally have to go back towards the direction that the trauma occurred in. It's very much like a drawer that won't open. If the drawer won't open, we can push the drawer in and shake it around, and then it'll open freely. Or a finger trap. If we just try to pull our fingers out, it keeps the restriction engaged. But if we push in, we disengage the restriction, and then we can slide our fingers out easily.